Good morning and welcome. My name is Asia Wofford, and thank you for joining me for my presentation on hair salons, specifically formaldehyde and hair care products. This presentation is scheduled to begin at 10:30 a.m. and will be posted on the Pennsylvania OSHA consultation website. So formaldehyde and hair care products, this format for this presentation is going to be a PowerPoint. For questions, our chat is going to be open. We will be answering questions through the chat feature. If due to the technical nature of the question, a more thorough response is required, we will post the answer on our website within 7 days of the webinar. I also want to note below that the IUP OSHA consultation office, our web address is at the bottom of the screen. So the objectives of this webinar is to help employees and employers identify various types of hazards regarding formaldehyde. We want to identify various hair products that contain formaldehyde and health risks associated with formaldehyde. We want to identify controls to reduce risks of formaldehyde exposure in hair salons. And we also want to discuss the short-term exposure limit and permissible exposure limit for formaldehyde. So what exactly is formaldehyde? Formaldehyde is a naturally occurring organic compound with the chemical formula CH2O. The pure compound is a pungent smelling colorless gas that polymerizes spontaneously into paraformaldehyde. Hence, it is stored as an aqueous solution. It is the simplest of the aldehydes. Formaldehyde is a known cancer-causing substance. Formaldehyde is also commonly used as a preservative in medical laboratories, mortuaries, consumer products, including some hair smoothing and straightening products. The report on carcinogens prepared by the National Toxicology Program listed formaldehyde as a known human carcinogen in its report on carcinogens. Formaldehyde was listed in the report in 1981 as a reasonably anticipated to be a human carcinogen based on sufficient evidence from studies in experimental animals. Since that time, additional cancer studies in humans have been published, and the listing status was changed to be a known human carcinogen in 2011. So formaldehyde-based chemistry is essential in the production of many personal care and consumer items. These products may contain formaldehyde-releasing ingredients, which act as a preservative to kill microorganisms and prevent growth of bacteria and other pathogens, extending product shelf life. So right here, we have some formaldehyde conducted hair studies. So the purpose of the article is to examine 2 cases of asthma in hairdressers exposed to hair smoothing products and to review the relevant literature on formaldehyde exposure in asthma. Also want to point out that the title of this article is Asthma from Hair Straightening Treatment Containing Formaldehyde, 2 cases and a review of the literature. So stylists regularly performed the hair straightening treatments and her throat became increasingly irritated and she developed sinus pain. Following 6 months of performing these hair straightening treatments with this irritating solution, her symptoms of severe throat ache, chest pain, lightheadedness, they did not lessen as they had at first. And her respiratory symptoms continued to be present. In 2010, this hairstylist sought medical advice from her general practitioner, who noted wheezing and referred her to a pulmonologist, who unfortunately diagnosed her with chemically induced asthma. The results indicated, so in this study, there's actually 2 hairstylists that were looked at. So the results indicated that both subjects developed asthma from repeated occupational exposure to formaldehyde during hair treatments. Both subjects became unable to tolerate straightening activities in their vicinity. So formaldehyde containing hair smoothing products are sources of exposure, and the risk of developing asthma is high in salon settings where hair straightening is performed using formaldehyde. So here's another study conducted on formaldehyde in hair salons and hair care products. It's called keratin-based hair smoothing products in the presence of formaldehyde. So in 2010, a stylist at a Portland area hair salon contacted staff at the Center for Research in Occupational and Environmental Toxicology, CREOT, as what it's also known as, at the Oregon Health Sciences University, OHSU, as a result of difficulty breathing, nosebleeds, and eye irritation when using a popular hair smoothing product. The salon had discontinued the use of the product due to these adverse effects. The product, when used as directed, is combed in, blow dried, and heated with flat irons during the treatment process. The material safety data sheet also indicated no respiratory hazards or related precautions. The container did not include chemical ingredients on its label. The Center for Research in Occupational Environmental Toxicology asked for Oregon OSHA's assistance in collecting a sample and determining the content of the product, known as Brazilian blowout solution. The Oregon OSHA laboratory analyzed the samples using 5 different testing methods. So each of the 5 separate analyses conducted that formaldehyde was present above regulated levels, with the quantitative methods proving respective results ranging from 6.3 to 10.6%. In analyzing samples of newer formaldehyde-free version of the product, OSHA's Oregon laboratory found it contained roughly 8.5% of formaldehyde. In response to these findings, and based not only on the lack of information available to stylists on the hazards, but also on the newer product's prominent label declaration and marketing the product as formaldehyde-free. CREO posted an advisory on its website on Oregon OSHA, began an enforcement initiative allowing it to obtain a significant number of additional samples from Oregon salons, as well as to conduct air monitoring in addition to the monitoring conducted at the request of several salons. So this is the OSHA formaldehyde standard, which is 1910-1048. So with the time-weighted average, the employer shall assure that no employee is exposed to an airborne concentration of formaldehyde which exceeds 0.75 parts formaldehyde per million parts of air, or 0.75 parts per million as an 8-hour time-weighted average. So the short-term exposure limit, the employer shall assure that no employee is exposed to an airborne concentration of formaldehyde which exceeds 2 parts formaldehyde per million parts of air, 2 parts per million, as a 15-minute short-term exposure limit. So the action level, which is the standards trigger for increased industrial hygiene monitoring and initiation of worker medical surveillance, is 0.5 parts per million when calculated as an 8-hour TWA. So with the standard continued, formaldehyde gas, all mixtures or solutions composed of greater than 0.1% formaldehyde and materials capable of releasing formaldehyde into the air concentrations reaching or exceeding 0.1 parts per minute should be considered a health hazard. Hazard communication. So employers should comply with the requirements, which consist of informing employees of specific health hazards associated with formaldehyde, such as cancer, eye and throat irritation. And there's also a lot of other specific hazards, health hazards associated with formaldehyde that we will talk about a little bit later. So workers at risk being exposed to formaldehyde, it's not only beauticians who are exposed to formaldehyde, it's also agricultural workers, construction workers who work with resin and manufactured products, workers who manufacture plastics, and morticians. So with the standard continued, employers should establish regulated areas where the concentration of airborne formaldehyde exceeds either the TWA or short-term exposure limit, and post all entrances and access with signs bearing the following legend. So I have a picture of the sign that should be posted when formaldehyde is in a regulated area. So it should say danger, formaldehyde may cause cancer, causes skin, eye, and respiratory irritation, authorized personnel only. So working with hair products containing formaldehyde, these hair products may contain or release formaldehyde. In 2011, federal OSHA found that stylists in 3 salons using either Brazilian blowout, Akai professional smoothing solution, or Cardaview Brazilian Keku were exposed to formaldehyde above OSHA's 15-minute short-term exposure limit of 2 parts per million formaldehyde, putting their health at risk. In one salon, formaldehyde levels during the blowout drying phase of the treatment were measured at 5 times the OSHA short-term exposure limit. So many keratin-based hair smoothing products contain formaldehyde, which is dissolved and chemically reacted in water with other ingredients in the product. Because of the way formaldehyde reacts in these products, some manufacturers, importers, or distributors might list other names for formaldehyde on the product information, or might claim that the product is actually formaldehyde free. So formaldehyde might be listed as methylene glycol, formalin, methylene oxide, paraformaldehyde, formalic aldehyde, methylene, oxymethylene, oxymethylene, or case number 50000. So there are various names for formaldehyde. It is important to know whether salon products such as straighteners, conditioners, and shampoos can expose workers to formaldehyde, as well as what you should do if your salon or beauty school uses these products. Products of concern might contain ingredients that are synonyms for formaldehyde or methylene glycol, such as formalin or other listed names on this slide I have provided. So we kind of went over a few of these in the last slide, but again, formalin, methylene, oxymethane, or other various synonyms used for formaldehyde. So any of these names can be listed in a product. And I'm guessing that sometimes these hair salons or hair stylists don't recognize the various synonyms that can appear for formaldehyde. So chemicals that can release formaldehyde. Hair salons might also contain chemicals that release formaldehyde when the product is heated, such as during the flat ironing or blow drying process. So I've listed several examples of chemicals that release formaldehyde. So these are also other synonyms of formaldehyde, such as thymonic acid, thioproline, and we have the last one right there. I'm not going to try and pronounce that one, but that is also a synonym or a chemical that can release formaldehyde. So for the hair care products that contain formaldehyde, I actually tried to find pictures of the products. I actually seen a couple of these in my local Target. So I just want to list the hair care products that contain formaldehyde. This information can also be found on the OSHA website. So to name a few, we have the Professional Brazilian Blowout Solution. We have the Soft Chocolate Gentle Smoothing Treatment. We have the Soft Gentle Smoothing Treatment, Chocolate Extreme Defrizzing Treatment, Advanced Brazilian Keratin Treatment, Brazilian Keratin Treatment. We have the Keratin Complex Smoothing Therapy. And all of these products listed on this slide do contain formaldehyde. And this can also be found, like I stated earlier, on the OSHA website. So how can these workers be exposed? So workers can be exposed to this chemical by breathing it in through their nose or mouth, getting it on their skin, getting it into their eyes or mouth, and can be exposed accidentally if they touch their face, eat food, or drink after using a product containing formaldehyde without first washing their hands. So what are the health effects from exposure to formaldehyde? So eye irritation and damage, including blindness, nose irritation, including bloody noses, skin sensitivity, such as rashes and itching, breathing difficulties, such as coughing and wheezing. Levels of formaldehyde above 0.1 parts per minute in the air can irritate a person's nose, throat, and lungs. These symptoms will get worse as formaldehyde levels increase. So formaldehyde is a sensitizer, which means that it can cause allergic reaction of the skin, eyes, and lungs, such as asthma-like breathing problems and skin rashes and itching. So what can we use to monitor formaldehyde? I actually included the detector on the right-hand side of the PowerPoint. So exposure monitoring, the initial monitoring, all employees who may have been exposed to at or above the action level or short-term exposure level. Periodic monitoring, so exposures to or above the action level, repeat monitoring every 6 months. Exposures at or above the short-term exposure limit, the monitoring should repeat it at least once a year during the worst case conditions. So when the air sampling results are less than the OSHA short-term exposure limit or permissible exposure limit, so whether or not air tests show formaldehyde levels above OSHA's limits, employers must follow certain parts of the standard if a product does contain the formaldehyde. So they're supposed to give employees appropriate gloves and other personnel protective equipment, such as face shields, chemical splash goggles, chemical resistant aprons, and also train employees on how to use this equipment while mixing and applying the products. We also want to, the employer also wants to explain to workers how to read and understand the information on a product's label and material safety data sheet. Employers also want to make sure the workplace has a eye and skin washing equipment if products that contain formaldehyde could be splashed onto the worker's skin or in their eyes, which actually can happen frequently often in a hair salon. Employers should train workers on how to safely clean up spills and properly throw products out. Employers should also keep records of their air tests they perform and any medical attention needed by their employees and a respirator fit test. So record keeping and requirements. So these employers are required to do the following regarding exposure records. They're supposed to retain records for 30 years, retain medical records for 30 years after the employment ends, and also allow access to medical exposure records to current and former workers or their designated representatives upon request. So based on air testing and product sampling, OSHA, the US Food and Drug Administration, the FDA, California OSHA, and the California Department of Public Health have all issued warnings and/or citations to smoothing product manufacturers for violating rules for formaldehyde labeling. Oregon OSHA and the National Institute for Occupational Safety and Health, NIOSH, have also found that certain hair smoothing products contain or release formaldehyde. The Connecticut Department of Public Health, New York State Health Department, and Health Canada have also issued health warnings to salons and consumers about the formaldehyde in the hair smoothing products. So the hazard communication for formaldehyde in standard 1910-1048, specifically M11, chemical manufacturers, importers, distributors, and employers need to comply with all requirements of the hazard communication standard for formaldehyde. In classifying the hazards of formaldehyde, at least the following hazards need to be addressed. So cancer, skin and respiratory sensation, eye, skin, and respiratory tract irritation, acute toxicity effects, and flammability. Employers shall include formaldehyde in the hazard communication program established to comply with the OSHA standard 1910-1200. Employers shall also ensure that employees have access to labels on containers of formaldehyde and to safety data sheets, and the employee is trained in accordance with the requirements in the section in section N of the section 1910-1048. So what can hair salons and stylists do to reduce their exposure to formaldehyde? So these employers, stylists, and other salon workers should read the product information and material safety data sheets for the products they buy and use so that they know what chemicals are in them and how to use them safely in the workplace. But the best way to control exposure to formaldehyde is to use products that just do not contain formaldehyde, formalin, any synonyms of formaldehyde. So protecting workers' health. Employers want to test the air in the salon during product use to determine if workers may be exposed to formaldehyde levels at or above OSHA's limits, which is 0.75 parts per million of formaldehyde for an 8-hour work shift, or the short-term exposure limit, which is 2 parts per million during a 15-minute period. These employers must also notify the workers of their air testing results. To also protect workers' health, employers can give workers the right gloves and other personal protective equipment and train workers how to use the equipment. It's also very important to explain to workers how to read the material safety data sheets and to make sure there is a eye washing station if products that contain formaldehyde can be splashed into the worker's skin or onto their eyes. So protecting workers' health continued. You want to inform and train workers about the health effects of formaldehyde, including signs and symptoms, how to use the product safely, what protective equipment to wear, how to safely clean up spills, how to properly throw out products, and how to handle formaldehyde contaminated clothing and equipment. Workers must be trained at the time of their initial assignment and annually thereafter. To protect workers' health, it's important to prepare a written hazard communication program that describes how workers will be informed about labels and other forms of warning, material safety data sheets, and training requirements. So prevention and control methods, I have listed the hierarchy of controls that NIOSH applies to total worker health, which is to eliminate, substitute, redesign, educate, and then encourage. So according to standard 1910-1048, engineering controls and work practices, the employer should institute engineering and workplace controls to reduce and maintain employee exposures to formaldehyde at or below the time-weighted average or short-term exposure limit. Another way to prevent or control is to possibly require workers to use lower heat settings on blow dryers and flat irons used during this process. Another control method is to give workers respirators if needed, train them on how to use the respirators properly, and meet the other requirements in the OSHA respirator protection standard. So continuing on how employees can protect workers' prevention methods. Post signs at the entryway to any area where formaldehyde is above OSHA's limit to tell workers of the danger and stating that only authorized personnel may enter. We actually went over that on a slide within this presentation. Tell workers about the health effects of formaldehyde, how to use the product safely, and what personal protective equipment to wear while using the product. Train workers on how to safely clean up spills and properly throw products out. In addition, where the tests show that formaldehyde is present in the air at levels above 0.5 parts per minute during an 8-hour work shift or 2 parts per minute during any 15-minute period, the employer must get workers to the right medical attention and also test the air periodically to make sure that formaldehyde levels are below OSHA's limits. Another way to protect workers or some controls or prevention methods is to label all mixtures or solutions composed of greater than 0.1% formaldehyde and materials capable of releasing formaldehyde into the air at concentrations reaching or exceeding 0.1 parts per minute. For all materials capable of releasing formaldehyde at levels above 0.5 parts per minute during normal use, the label must contain the words potential cancer hazard. It's also going to be important to train all workers exposed to formaldehyde concentrations of 0.1 parts per minute or greater at the time of the initial job assignment and whenever a new exposure to formaldehyde is introduced into the work area. It's also important to repeat this training annually and also to select and provide and maintain appropriate PPE. And also want to ensure workers use PPE such as impervious clothing. So for the salons that do decide to continue using formaldehyde products, they must follow the requirements in OSHA's formaldehyde standard, which states this standard requires that employers test the air to find out the level of formaldehyde present in the air when the product is being used. If the test shows that formaldehyde is present at levels above OSHA's limits of air during an 8-hour work shift, then the employer must install air ventilation systems in the area where these products are mixed and used to help formaldehyde levels below OSHA's limit and perform regular maintenance to make sure the systems work correctly. So this actually wraps up my presentation. This webinar was actually created to educate hair salon and beauty product sector personnel about the risks connected with formaldehyde-containing products, as well as the numerous control methods and resources available to identify and eliminate health hazards. I just want to thank you for joining me today. So here I've listed my references for my presentation. If you have any questions, please feel free to shoot any in the chat. So right here is the PA OSHA consultation webpage. It is listed below in the right-hand corner. If you have any questions, please come to this webpage. The contact information for the Pennsylvania OSHA consultation website is listed. Again, if there are any questions regarding this presentation or future presentations, please feel free to reach out and contact us. And again, thank you. The upcoming webinar is going to be about industrial hygiene exposure assessments, why, when, and how, and it's going to be hosted on April 13th, 2022 at 10:30 a.m. Again, thank you for your time. Again, I would like to thank you for joining me today for my presentation regarding formaldehyde in hair salons and hair care products. I would like to clarify that ppm stands for parts per million and not parts per minute. I do apologize.